Times of happiness and in times of need, during crucial occasions, at any hour of the day. No matter what the situation is, Gleneagles Hospital Kuala Lumpur is here for you. We're committed to caring for all your healthcare needs, to greet you with our friendly smiles, and to support you with our excellent service. We ensure our hospital is well equipped with complete facilities and services. So, you can have peace of mind knowing you're in the good hands of our medical experts. As you rest in a comfortable environment and ambience to heal and recuperate. Our care also extends to your diet and meals. Our food and beverage crew offers local and international cuisines, taking great care to serve nutritious meals to you. Gleneagles Hospital Kuala Lumpur is known for its extensive range of medical specialties. With approximately 200 qualified medical consultants, we are dedicated to providing you with quality healthcare and to prioritize your needs every step of the way. To ensure you're given only the best quality of healthcare, we stay on top of modern medical breakthroughs with state-of-the-art technology and medical procedures. But our care isn't limited to just the four walls of our hospital. We go beyond to reach out to the communities in need through our social outreach programs. With national and international recognition, we strive to uphold our standards of excellence for every patient that walks through our doors. Our journey in healthcare continues on. With a growing and passionate team, we are dedicated to care for you. We are on your side, now until beyond. From the moment we step into our uniforms and greet the first patient of the day, we're on your side. In times of happiness and in times of need, during crucial occasions, at any hour of the day. No matter what the situation is.
Hi, welcome to our discussion on the power of prevention. I'm your host, Karen. I'd like to start by introducing our guest for today. We are honored to have Dr. T.M. Shamani, the highly respected head of health screening center from Gleneagles Hospital Kuala Lumpur. Welcome, doctor. How are you?
I'm fine, thank you, Karen. How are you
So,
doing?
I'm great. Thank you for asking. It's really great to have you here. Thank you also for taking the time to talk to us about a very important topic. We have many people in the audience today waiting to hear from you and to ask questions. So at the end of the presentation, there will be a Q&A session. Please leave your questions in the chat and we will address them shortly. Before we begin, could you share a bit more about yourself, Doctor?
Okay, so hi everyone, to all viewers. When I actually completed my housemanship, my last posting was actually emergency department. So at that time, I thought that was going to be my future, and I started going more for trainings and all related to emergency medicine. So at some point, I was the ACLS trainer, BLS trainer, BTLS trainer, and along the way I decided to join private. So when I joined private, I also went to the emergency department there, and we used to see many different type of cases, people coming in with heart attack, people coming in with head injury, a lot of very serious cases, And at one point of my life, when I was doing my MBA, that was when I met more people, and the discussions that we had along the way, I realized actually preventative medicine is actually much more important. I started realizing the value of preventative medicine compared to the reactive medicine. That means reactive medicine means it's like what we do in the emergency department. We are trying to solve the things. So prevention is always better than cure. So that is something that I learned along the way, and that was when I actually thought, okay, maybe I should try health screening. So I came in to Gleneagles as one of the doctors, the health screening doctors, and then shortly after that, I was promoted to be the head of department.
Okay, thank you so much for sharing, Doctor. It was lovely getting to know your background. And we will now start with our presentation. I leave it to you, Doctor.
Okay, so preventive healthcare is actually okay. The goal of annual checkups, okay, is actually to detect diseases early when they are more treatable and manageable. So there are many health conditions like high blood pressure, high cholesterol. These health conditions often have no symptoms until serious complications arise. So this scope of webinar, actually this session will actually walk you through what happens during a checkup, what specific tests are usually done during the checkup, and how this will actually help in maintaining a long-term health. All right. So going to why health screenings are actually essential. So you see, health screening, you actually have proactive healthcare and you have got reactive healthcare. Reactive healthcare means when you have the symptoms, then you go to the doctor will give you the medications, and then you will go back. Proactive healthcare means before the symptoms even come, you want to go and detect and do something. You do a screening to actually check if there is something, and then you treat it before the complications actually arise lah. So most Malaysians, we actually focus on reactive healthcare, right? So um, let's say we wake up and then we have fever, we have a cough or anything, we'll go to the doctor, and then the doctor will prescribe the medications accordingly. So that is how usually we practice. But proactive healthcare differs from reactive in sense that action is taken before the symptoms actually manifest. So rather than waiting until you feel the symptoms, you actually take a proactive approach, just like how we have to drink a lot of water during the under the hot sun, and then we have to take vitamin C, and then we have to wash fruits before we eat it. Simple things that we practice, all this is actually proactive healthcare. So doing a health screening is actually one of the proactive healthcare. Okay, so why is this important? Number one, we can actually detect a health condition before it gets serious. Okay, so that's something can be done about it. Number two is also the cost. Sometimes we feel that yeah, why I want to pay so much and do the health screening, but actually if you look at it in another way, if complications arise and you need to do surgery, then you cannot take any discount for the surgery cost already. The healthcare cost will be even much higher when the complication arise, right? So that is about the proactive versus reactive healthcare lah. So we advise you to go towards the proactive healthcare. All right. So the second point would be early detection saves life. So I would like to share a story about someone who was very dear to me, my teacher actually. So there was one random day when she actually felt a lump in the breast. And when she felt it, she didn't want to do anything about it because, it's at the breast, and it's embarrassing to talk to people about it, and she was very shy to go to the doctor as well. So she thought, okay, never mind, let's wait and see what happens. After a few months, it started growing rapidly. Then, she started having swelling at the armpit and things like that. So she knew something is wrong. But again, she was very scared to go and get it checked. After another few months, when she actually took the courage to go to the doctor, it was actually stage 4 of breast cancer already at that time. So when she gave me a call, she was already at stage 4. And the first thing that she asked me was, Cham, the doctor is telling that there is nothing much that can be done. Is it true? And at that time, I felt so crushed because, as a doctor, I feel that if this was detected much earlier, at the moment she felt the lump, if at that time she already seeked treatment, probably something could have been done. There are so many varieties of treatment for breast cancer. If it's just a lump, if it's very early, if it's just a lump, they might just remove that lump. If it involves the breast tissues, they might do a mastectomy. That means they might just remove the breast. So, and then they have got the chemotherapy, radiotherapy, and also there are a lot of things with this advanced technology. There are a lot of things that could have been done. But the thing is, she went to seek help at a very late stage. So that points to early detection save lives. Okay. So that is why early detection is actually very important. Now, the next point would be silent killers. Silent killers would be like health conditions like high cholesterol and high blood pressure. You actually won't have any symptoms. Okay, when you have got high cholesterol, you won't know you have high cholesterol. But what happens is, the cholesterol, there's good cholesterol, bad cholesterol. The bad cholesterol will actually build up in the arteries. Okay, eventually these deposits will grow along inside the artery, and it will make it difficult for the blood to flow through the arteries. So when this happens, sometimes these deposits can actually break and form a clot. When the clot actually blocks the artery, you won't have any blood going to the heart. This can cause heart attack. So the same thing happens in hypertension. Hypertension, the force of the blood in the artery increases, and this damages the artery. So when this happens, it can actually cause stroke, it can cause heart attack. So there are a lot of things that can be detected early. If the hypertension is detected early, if the person can be started on medications early, at least it may not reach stroke, may not reach heart attack. Today, many people around us, we are just hearing, oh, they passed away due to heart attack, they passed away due to stroke, these kind of things. But what actually happened 10 years ago, no one knows. Because only when they have the symptoms only, we are going to the doctor. So that's the main reason why health screenings are actually essential. Okay, so going to the next slide. So many of you feel that health screening actually is taking blood. Okay, so a lot of them that I've met, whenever I go out for functions and all, they know I'm working in the health screening department. So they'll be like, oh, that means you're working in health screening department. That means you'll just take blood, doctor, like that. So no, there is actually a variety of things that we do there. So among the things that we do in the health screening department is, so there will be consultation and physical examination by the doctor. So when you actually come in, when you register, you will already decide, okay, I want this package, I want to take this package and things like that. But when you meet the doctor, when the doctor do the physical examination, let's say the doctor feels a swelling at your neck, okay, or the doctor feels a lump during the breast examination. So the doctor will advise you on what to add on, what other investigations to add on, which is necessary for you. All right. So, and then when you go in, the nurse will take your height, your weight, your BMI. This one all is to see whether are you underweight, are you in the normal range, or are you overweight. So all this is very important because all these are the risk factors for the heart attack and stroke that we were talking about earlier. Okay, so besides that, blood tests like blood sugar, your cholesterol, liver and kidney function test, your full blood count, your tumor markers. So all these comes under blood tests. We have got a profile where we have got most of the important things in the profile. So we have put it in the package as such. So the moment you come and take the package, everything is in already. So besides that, to check your lungs, we have got chest x-ray. And then to check the heart, we have got ECG, stress test, and echo. If you're wondering what are these, so ECG is usually the resting ECG, where you actually will just lie down there. They will put the electrodes there. So this one is to see the pattern, the electrical impulse in your heart. Stress test is the treadmill. You all would have heard, if you have never been for any health screening, you all would have heard about this treadmill in the health screening. So what they actually do, they will connect the electrodes and they will make you run on the treadmill. So there will be stages. So first you will walk, and then you will walk faster, and then you will run. They will see how much you actually can go. While you are doing that, they are going to monitor the pattern, of the it's like a ECG there while you are running. So what they are actually doing is, stress test is actually to identify coronary artery disease. If let's say the artery is about 70% blocked, you will get stress test positive. So we will be able to see it through the pattern of the ECG reading. So all these, like in Gleneagles, it will be all certified it will be all reported by the cardiologist. We have got the cardiologist on call, so they will report all these readings. And then we have also got the echocardiogram, which is the ultrasound of the heart. Ultrasound of the heart is to see any structural deformity of the heart and things like that. And then we also do the hearing test, the audiometry, right? And then for ladies above 40, we've got mammogram. And then for the rest of them, we have got ultrasound abdomen. Usually ultrasound abdomen pelvis will be in most packages, but ultrasound breast and thyroid and all, it will be an add-on, right? And then we have got bone density also to identify osteoporosis. So there are so many stations that actually will be covered if you come, all right? So who should be screened and when? So just now you all saw a long list of, investigations that would be done. So you'll be wondering, do I need to do all these things? So the answer is no. Not all tests are necessary for everyone. The type and frequency of screening, it actually depends on factors such as age, medical history, and your risk profile. So for example, a person with family history of heart disease, we may need to, check your cholesterol level, your blood pressure, all these we should not miss, and then if let's say you're interested to check for the other aspects of your heart, we can do the ECG, we can do stress test, we can do echocardiogram, things like that. All right. So like in young adults, let's say in young adults, you don't want to do anything very complicated. You just want to do something simple and basic. Okay, sometimes we do have people coming to us. Sometimes they will ask me, doctor, what would you recommend me to do? So I'll go through their history taking, and I'll do a history taking. I'll go through their history, and I can tell them, what, actually, okay, you don't have very high risk. Maybe you can do just basic check, like, your blood pressure, your cholesterol, your glucose check. So the basic ones. And then if we find anything wrong, then probably we can do anything else lah. We can add on something else. Like 40 years and above, usually we can do like bone density, like mammogram, it's usually 40 years and above. Below that, usually we'll do ultrasound breast only. So it depends on the risk factors. And then additional screenings, like for seniors, 60 and above, usually we will do hearing tests, vision tests, things like that. Okay, so at the end of the day, what test you will do, actually, you will have to discuss with the doctor to see if there's anything else that we need to add on. All right. So coming to understanding your test results. So blood pressure, okay, according to WHO definition, we consider it hypertension when there is a few readings of more than 140 over 90. Okay, so then we consider that as hypertension. So not only one reading, because sometimes blood pressure, it can be influenced by your stress. If let's say you are in pain, also your blood pressure can be high. So it doesn't mean that suddenly when you're in so much of pain, you check your blood pressure, if it's high, oh my God, don't tell me I got hypertension. No, it doesn't work that way. Okay, so it should be taken when you are at rest, okay, and when there is no other factors associated to it, and should be a few times. That is why people with borderline blood pressure, that means like if the systolic is that upper number, if that is between 130 to 139, okay, that means just below 140, usually we'll ask them to monitor. We will ask them to write down how much is it for that 1 week. The same thing below also. It's between 80 to 89, the diastolic blood pressure, same thing you tell them to monitor. Okay, cholesterol levels, we have got two types of cholesterol. We have got good cholesterol, we've got bad cholesterol. So why do we call that good cholesterol a good cholesterol? So good cholesterol is actually HDL. Okay, so why it is good is it actually takes the other cholesterol to the liver, where it can be removed from the bloodstream before it builds up in the artery. Okay, so this HDL is actually like a hero inside our body, okay, inside our bloodstream. So food that has high HDL is like fatty fish, nuts, avocado, olive oil. So all these actually has high HDL, and we want more high HDL in our body, okay, as compared to LDL. The villain in the body is actually LDL. So LDL actually is the other type of cholesterol, where it takes the cholesterol directly to the arteries, okay, and that is the one that I mentioned earlier. The fatty deposits will build in the artery, and then it will cause narrowing of the artery, and then at some point it can just break and it will become a blood clot, and that is when heart attack happens. Okay, so this is cholesterol. So cholesterol, we have got HDL, we have got LDL. Okay, so when LDL is high is when we all panic. We all be like, yeah, that one something needs to be done immediately. Okay, and the one thing that we can do to reduce the cholesterol level, number one is exercise, of course. Something that all of us, we find ourselves very busy in our daily lives, that we tend to ignore it. But if we ignore it, this is what's going to happen. This LDL is going to take control. The villain is going to take control. HDL is trying to help us, but if there is not enough heroes in the body, then the villains are going to take control. So that's how I look at it. And then we have also got triglycerides. That's like the third component of cholesterol. So if, let's say, we are eating, right, calories, so we are eating, but we are not burning enough calories. So all these unused calories, actually, they are stored as fat in the blood. So that makes up the triglycerides. Okay. So, and then coming to the blood sugar levels. Okay, blood sugar levels, we've got two types of blood sugar. Uh, like we will interpret it in two ways. So one is the fasting blood sugar level. That means the day before you will fast at least 8 hours, right? Before you come for your test. So we will test. So that is your fasting blood sugar level. Another way to see your sugar level in the body is through HbA1c. That one, they will actually evaluate your 3 months control of your sugar level in the body. So that one is also very important. So if that HbA1c will actually tell you if you are still in the normal range, if you are in a pre-diabetic range, or if you are already in a diabetic range. So that's also a very important thing to do lah. So follow up is actually, let's say if they find your cholesterol at the borderline levels, so the doctor will usually tell you, okay, you'll need to do the blood test, in another 3 to 6 months, just to see. But if you want to repeat the blood test, you have to do something. You have to do exercise. You got to reduce fatty food. You got to reduce fried food. You got to reduce your sugar level. So all that, they will teach you what are the lifestyle modification that you can do in order to achieve a better results. So all this is usually done in the health screening department. You'll actually see the doctor. When the doctor actually review these results with you, all this will be discussed. All right. So, okay. So going to the myths about health screening. So myth one, if I feel fine, I don't need a health screening. Okay, so as I have emphasized a few times in this presentation, many serious health conditions like hypertension and high cholesterol, and even early stage of cancer, they don't show any symptoms until serious complications arise. So screening actually helps to detect the issues before the symptoms arise, allowing early intervention. So the fact is, it doesn't mean that if you feel fine, you don't need a health screening. Many of them who come to the health screening department for medical checkup, most of them actually feel fine. In fact, if you don't feel fine, you should go to the emergency department. Okay, so that is the myth one. So myth two, health screenings are only necessary for the elderly. So this is also wrong, because if you notice at this point of time, many of them, very young people, as early as 30s, are actually dying due to heart problem. So all this is actually due to their lifestyle. Okay, so usually conditions like diabetes and heart disease, it can affect people at very young age, 20s, 30s year old. So if let's say they have poor diet, they have lack of exercise, they have family history, all these risk factors actually starts very much earlier. So it doesn't mean you need to wait until you are a certain age and then only start doing health screening. All right. So it's very important to identify your risk factors as early as possible. Only then we'll be able to do something about it. Okay. So myth three, a negative screening means I'll never get that disease. So no. So a screening result that comes back normal at that point of time, it doesn't mean that you are immune to that condition forever. It means that at that particular moment you are clear, but regular checkups are important to catch any future developments. So this is something actually very important to be clear, because many people believe that, okay, one time I do my health screening means for the next 10 years I don't need to do it. No, it is not that way. All right. Okay, next. All screening tests are painful or invasive. So as I showed earlier, all the things that we do in the health screening department. So among all, the only thing that's invasive actually, it's the blood taking. But there is no other way to take the blood other than pricking. So other than that, everything else is actually not painful. They take your height, they take your weight, they take your blood pressure, and then they do the X-ray, they do the ultrasound. So ECG, everything else is just outside only. Nothing else is going to hurt you. It's just it is just something over the outer aspect only lah. All right, so no, that is definitely a myth. Okay, so the fifth one, screenings are only useful if you have symptoms. So the whole goal of screening is actually to detect potential healthcare problems before the symptoms appear. So finding an issue early gives you the best chance to treat it successfully. Okay, so at this point, if you're going to wait for symptoms and then only go for screening, the symptoms may actually be the complication already. So we may not be able to offer the best treatment at that stage, just like the story that I shared earlier. All right. Okay. So luckily there's only 5 myths there.
Yes. Thank you so much, Doctor. And hello to the audience. And thank you for being so interactive. We have a very interactive audience down here in the chat, Doctor, by the way.
Oh,
And
I see.
yes, a lot of compliments, a lot of people saying that, your insights are helping them a lot. And let's move on to the Q&A session. So thank you for your expertise and your valuable insights, Doctor. So we will move on to the Q&A session. Please share your questions in the chat below and we will answer them. However, we have a few questions submitted to us by our audience. So the first question I received, Doctor, was, I have never gone for a health screening before and I'm in my 40s. I understand that I should now go for a regular health screening at this age. How do I get started?
Okay, so thank you for your question. Okay, so number one, I need to applaud you for actually even having the intention of going for a health screening. Okay, so it's always never too late to start your first health screening checkup. Okay, and when I say health screening, even though we are from the Gleneagles Hospital Kuala Lumpur, you can do your health screening anywhere convenient to you. The whole intention of bringing this topic up is to actually create awareness. Okay, so go anywhere convenient to you and do your first health screening. So first thing you need to do is you got to pick up the phone and you book an appointment at any health screening centers convenient to you. At 40 years old, besides the regular things that we usually do, the blood test, the chest x-ray, ECG, ultrasound, abdomen, pelvis, besides all this, if you are a female, you can add on mammogram. Okay, so for very high risk, if let's say the person has a family history of breast cancer or anything like that, besides mammogram, you can top up with an ultrasound breast as well lah. Okay, and then you also can consider bone density for osteoporosis, and of course ECG, stress test. So at our center we have a package for that as well. We've got our premium plus package that we can add on the ultrasound, breast and mammogram as well lah. So I'm sure everything will go fine for you, and I hope you don't wait too long before getting it started. Go ahead, and all the best to you.
Okay, thank you, Doctor. And actually, in the audience now, we have somebody who asked, how can I prepare for my health screening? And what do I need? What do I have to know and do the day before my health screening?
Okay, so number one, you have got to fast. Okay, let's say tomorrow 8 o'clock is your appointment. So you will, number one, you will need to fast at least 8 hours, 8 to 10 hours prior to the screening. Okay, so fasting is required specifically for the blood test, for the ultrasound abdomen pelvis, for the urine test as well. So avoid taking any what do you call this diabetic medications because you'll be fasting, so we don't want you to take any diabetic medications that can lower your glucose level, because in case there is a delay in the blood taking or in the ultrasound or what, sometimes the person can get hypoglycemic. So don't take that medicine before coming lah. However, antihypertensive medications and all that is all fine. All right. And then for ultrasound abdomen pelvis, usually at that center itself, they will ask you to drink about 3 to 4 cups of plain water to fill the bladder up, so that the radiologist can actually do the ultrasound of the pelvis lah. So that one is for the ultrasound of the pelvis. So this is actually to allow better visualizations of the pelvic organs. All right. And then for stress tests, usually you are required to come in your sportswear. So cotton sportswear is preferable. Don't wear any jersey material, because when they attach the electrodes, it can interfere with the readings. All right. So, and then wear your sports shoe as well, because if you're going to do the treadmill stress test, you have to run. Okay. And then okay, for x-ray, x-rays are not recommended for anyone who is pregnant or may be pregnant. Okay, so so that one, if let's say if you are suspecting that you may be pregnant or anything like that, we would actually do a beta HCG test. That means a pregnancy test, to just confirm lah. Okay, before we proceed with it. And then for mammogram, we usually advise not to wear any deodorant, any perfume, anything like that under the arms or the chest area, as it may interfere with the quality of the mammogram. So, and then special advice to women, because sometimes, the menstruation date. So usually if a lady comes for health screening and she's on her first day of menses, she won't be able to do a few tests like the urine test, the pap smear test, and if she has stool test also, she won't be able to do. So usually what we'll do, we advise you to schedule it in such a way that it's not during your menstruation time. Okay, but if let's say you've already scheduled it and you have already at the center only you realize that it's your first day of your menstruation, don't worry about it. You can do all the other tests. So only your pap smear, your urine test will be done at another date. So it will be at least about 7 to 10 days after your menstruation. So these are all the general recommendation. But if there is anything else specific, usually we will mention when you register at the counter.
Okay, thank you, doctor. Something as simple as what to wear, what shoes, what type of clothes, what material. I think people, well, myself, don't really have that knowledge. So, something as simple as that is actually very helpful.
Thank
We
you.
have time for one more question, doctor, if that's okay. We have
Yeah.
a lot of questions, actually. If you look at the chat, there's a lot of questions, but we will try to answer as many as we can. We have one here that says, can at-home tests for blood sugar be used to diagnose diabetes?
Sorry, repeat again.
Can at-home tests for blood sugar be used to diagnose diabetes? That's the question.
Okay. So the thing is, never self-diagnose yourself. Okay, not only for diabetes, but for anything at all. Now, with the advanced technology, everyone is reading Google. They got a bit of headache, they go in Google, and then the Google will say, oh, this may be cancer. So please don't self-diagnose anything. So anyway, the home test that is used for blood sugar, it is called a glucometer. This glucometer is actually a medical device that is actually used for glucose monitoring by known case of diabetes people. So people who have already got diabetes mellitus, they have already been diagnosed. So they are the ones who will actually use this glucose monitoring to monitor the blood glucose. So don't diagnose yourself with diabetes based on that. That is not very accurate to diagnose yourself lah. So the more accurate way would be to actually go and do a proper check. Okay, take your fasting blood sugar, do your HbA1c at a proper center with a proper lab, and then let the doctor actually review the results, see your risk factors, see your family history and everything, and then the doctor will advise you accordingly. Thank you for this question. The thing is that many of them actually they tend to read it from the Google, and they will actually diagnose everything themselves. So
Yes, yes. Like
so
Dr.
yeah.
Yeah, online there's a lot of information. It's good to keep yourself equipped with that information, but it's best to go to a medical practitioner,
Correct.
for this.
Correct.
Yeah, that's a very good answer. Okay, I think that concludes our Q&A session. I apologize to all that we haven't been able to address. However, you can find out how to address these things with our doctor personally. But before that, I would like to say thank you again, doctor, and we really appreciate it. On behalf of Global Health Asia Pacific, we appreciate your time. And before we wrap up, is there any additional advice that you'd like to share with us here?
Yeah. Okay, so before I was very worried if you're going to wrap up before giving me the chance to say the
Oh
the
no,
last. Okay,
please
so
go ahead.
firstly, Karin, thank you so much for having me in this webinar session. You have been very kind, and I really appreciate the support that you have been giving me. Okay, so to all the viewers, there's only one thing that I would like to say. I know you actually feel very scared to actually go for health screening, not because of anything, but because you don't want to know what disease that you have. That is, to be honest with you, you are not alone. All of us are also feeling that way. But as a doctor, what I would like you to know is it's better to detect something early. The fear of not knowing anything is actually not a very good fear. You would rather know something early and then solve it, because now with all the advanced technology, everything also you can have a solution, except for diseases which already has complications. For those kind of things, at this point of time, we have not came up with much solutions for that. So let's do the screening, let's detect things early. Okay, meanwhile, while you are planning to do your health screening, there are few things that you can actually do. Okay, that is, if let's say you find it very difficult to actually go out of your way and do exercise or what, you can actually get like a smart watch to actually count your steps. Or if you can't get the smartwatch, even in your phone also you can actually download the health apps where it can actually keep track of your steps. If each day you can achieve 10,000 steps, that would be a very good start actually, to start doing exercise. So that one is one thing. The second thing, the second small change that you can actually do in your daily lives is, when you go to a shop, when you go to a restaurant, when you order your food, instead of taking any sweet drinks, this teh tarik and, all these sugary drinks, these gassy drinks, try to opt for plain water instead. Actually, these little things will make a lot of difference. If let's say you're very used to taking 2 spoons of sugar for your coffee in the morning, if you can reduce it to 1 spoon, and then after that slowly reduce it to no sugar at all, that also will make a difference. So all these little things, and then also, when you are going upstairs, okay, you would rather take the lift. If there is stairs over there, try to go for that as well. So these little changes actually will make a lot of difference. And to all of you watching, I wish all of you all will always be healthy. And if you can actually make these little changes, it will be very helpful for all of you. Thank you very much.
Thank you, Doctor. That was very, very a really good piece of advice for our audience. We really appreciate it. And thank you. I haven't forgotten about the attendees, everybody here. Thank you for joining us today. Have a great day, and please keep an eye out for our future webinars. We have a lot more webinars coming up. So thank you, everybody, and goodbye. Bye.